So my personal experience at Highlander Health is that thoughtful partnership with the media is important to our progress. And let's learn together today why. We've got about 45 minutes for this session. It's going to move fast. So first I'm going to ask my panelists, with Jessica to my left, to introduce themselves and tell us a little bit about where they're from. Go for it.
Hello, everyone. I'm so thrilled to be here. Thank you very much. My name is Jessica Hagen. I'm the executive editor of MobiHealthNews, and I also do interviews for HIMSS TV, which the Health Information Management and Systems Society. MobiHealthNews is a publication of HIMSS. We also have our sister publications, Healthcare IT News and Healthcare Finance News. And I am the one who leads MobiHealth, so I'm very excited about that.
Wonderful. Well, welcome. Over to you, Katie.
So I am the associate editor at MedCity News, which covers innovation in the healthcare industry. My area of reportage focuses mostly on the tech that providers are adopting, their pilots, what they're scaling, as well as the regulatory environment, both at the state level and all the agencies and departments we have here in DC, as well as just the digital health venture landscape and then what fundraising looks like right now.
Wonderful. And Emma.
Yeah, hi, my name's Emma Beavins. I'm a staff writer with Fierce Healthcare. Like my co-panelists, I also cover digital health that ranges from AI, remote monitoring, telehealth, interoperability. I live here in DC, so lucky for me, this was a local event 10 minutes from my house, so I feel very lucky for that. And I kind of have grown up as a journalist in the DC landscape. I was at Inside Health Policy before Fierce Healthcare, covering telehealth policy news was my first job out of college, which is a very niche topic, but I know a lot about it now. So, but yeah, super happy to be here.
Wonderful. So we're here today to talk about the DIME 2030 vision and really thinking about how do we advance digital innovation. And I want to start really from your perspective. What separates a compelling healthcare innovation story from a forgettable press release? And Emma, I'm going to start with you over there at the end.
You guys will not believe the number of press releases we get in a day, like 50, 60, like if your company is putting out news, chances are every other company in the world is putting out news too. I think what separates innovation for me, one, if it's something I haven't heard of before, which is maybe a little bit basic, but as I said, we get a lot of pitches, and so if there's one that's like, oh, it has a slightly different tenor or the focus, like say it's an AI pitch, the focus of the AI is on a little bit of a different area than we've reported on before. Also, I think it's innovative if the academics are excited about it. They're, the nerdy ones who are up on the tech innovation, and so if academics are talking about something, that's something I like to pay attention to.
Terrific. Katie, I'm going to save you for a second because I'm going to come back to you. You'll see why. Jessica, over to you. What separates that compelling healthcare innovation story from the forgettable press release?
Well, I too, like Emma said, I get probably about 100 emails every day, and I tell PR people that I cannot possibly respond to every single one of those emails, but I look at every single one. So things that stand out, a good subject line. Give me a good subject line. Tell me the news in the subject line. I want to know it right away because I get so many emails. As far as innovation goes, I agree. Something that academics are very excited about, things I haven't necessarily heard about before that have backing. I mean, it's not anybody can say, oh, I do this new thing that's kind of amazing. You should check it out. And it's like, yeah, but do you have any backing that shows that it actually is beneficial to patients? So those are the type of things that I look for.
So catch their eye, and remember they're reading through and navigating lots and lots of interesting but and potentially compelling, but lots and lots of information. Katie, one time you said to me something along the lines that journalists were trained to be skeptical and to read the different things coming in with a skeptical eye. So how do you balance the breakthrough exciting announcement with that skepticism that comes from knowing that many claims don't hold up?
Well, I think, in college or high school when the whole Theranos thing was happening. So I was not a reporter, but I remember watching that Hulu series a couple years ago after I was a reporter, and I was thinking like, I would have definitely been fooled by this. Like, and especially we do get hundreds of these very like effusive press releases every day that really are sometimes just jargon and so promotional. So we are trained to be skeptical, especially at MedCity News. We really want to separate the noise and the hype from what is actually helping patients, helping providers, I guess maybe even helping payers too. Um, but something I love to see in pitches that I rarely see is like hard data. I see a lot of soft data. I see a lot of percent change. So an example of this was I recently got, it was a company for obesity and lifestyle medicine, diabetes, managing those chronic conditions. And they were saying that they increased the patient population's daily exercise by 48%. And it's like, okay, well, going from 10 minutes to 20 minutes is very different from going from an hour to an hour and a half. So can you show me like, what did this patient population, what did their daily exercise minutes look like before and what does it look like now? Similarly, you can tell me you lowered costs by 30%, but can you show me how much it costed before, how much people are paying now? They almost never give up those numbers or have them at the ready, which is a little frustrating because the percent change, they'll be hawking data, but the data doesn't mean much when you unpack it. So something that's very attractive to me is when an AI startup is really honest and is prepared with kind of the proof. And I know that's difficult because a lot of these products are really nascent, but that always stands out to me.
Yeah, that was one of the things that really caught my attention was that, you're in the know, like you're seeing lots of different companies and starting to recognize like what are meaningful outcomes and asking the question, is this really meaningful? So Jessica, what does a compelling story look like? How does a innovator tell you a compelling narrative? Kind of walk us through that.
Oh, that's a tough question. What does a compelling story look like? I mean, it's so subjective to so many people. I would say a compelling story to me looks like it would actually make a difference in a patient's life. You can make any type of claims that you want. Anybody can make a claim that their company does something specific. You have to have proof to back it up, just like she said, right? We, as journalists, need to make sure to do the research to ensure that whatever you're telling us is accurate. So if I find something right off the bat that catches my eye, and then I look deeper into it, and it actually does what it says it does, and maybe even more than what I thought it did, that would be definitely compelling to me.
Interesting. Emma, do you want to expand on that? Like, what's it look like from your lens?
Yeah, I think something that I've been thinking about is I don't want or need a compelling story handed to me through a press release or through a pitch to a PR person. That's kind of the journalist's job, I think, is to do the reporting, to find, what actually matters in the situation. And so I think as a journalist, I don't want to be handed something that's like a fully baked narrative that then you want me to like parrot, right? So I think I like engaging with founders that are very honest about what they're doing. They're very enthusiastic about the problem they're trying to solve. I've talked to lots and lots and lots and lots of AI founders, and you can tell, and I'm sure you guys can too, when you're speaking to someone like, okay, this is someone who's hopped on the bandwagon a little later, or this is someone who's been studying AI since 1995 and they like actually know what's going on. And so I think when founders are willing to engage honestly about the problem they're trying to solve, when they're willing to admit limitations sometimes or things they haven't figured out yet, that's much more compelling for me to like work with that information and then do my other reporting to pull together a story rather than like a PR person trying to hand me a story that's already done, if that makes sense.
Totally makes sense. Katie, I'd love for you to expand on this theme a little bit. I think, Emma, what you said was the journalist's job, and, kind of thinking about, kind of give us a little bit of an under the hood view of what you see the journalist's role is and what you'd like people to know about the journalist's job in media.
I definitely related to what you said about you don't want the story handed to you, and it feels cheap, and you're less likely to write it when there is that fully packaged story ready for you. So as a journalist, you kind of want to uncover the process, and you're, especially when you're getting press releases, you are handed the final success story. But in healthcare, there is so much, especially in digital healthcare, there's so much iteration and failure and learning from those mistakes. And if you were in the number 3 breakout room over there, that was something that the leader of our discussion, Jen McKay, really brought up and said that, I think in the context, her example was in prior authorization, you can, as a physician, you're kind of learning through your mistakes. There's some of these regulations on PA are so unclear that you only learn how to do it once you've been told you're doing it wrong. And a lot of those lessons apply to, AI pilots. There's a lot of failure that you learn from, and you can tweak the pilot, and figure out what works and what doesn't. And those stories are really valuable. Those lessons are super valuable to healthcare providers and other organizations wanting to pilot or implement similar tools. So yeah, when you can talk to someone who's honest and candid about the process of how they got there, I think that makes for the best stories. And I think a lot of the stories that I like to write too right now are in a similar vein, talking about being candid and honest, is the acknowledgement that we don't have the answers to a lot of these questions, especially with the technology as novel as AI, how fast these models are evolving. Questions with, hallucination, ethics, we don't really have all those answers right now. And I think when someone can come to the table and acknowledge that and be like, well, this is where we want to head, I really appreciate that honesty.
Awesome. So Jessica, I'm going to come to you in just a second because I'm going to talk more about kind of getting deep into topics as it relates to healthcare and technology. But Katie, sort of following on the thread that you were just talking about, can you go a little bit deeper and share an example of when a company's transparency about failure, or some of those examples that the challenges that they've been navigating has helped the story actually be stronger?
I feel bad right now. I can't really remember what health system it was, but they were talking about a failed AI pilot. I think it was a tool for detecting when a patient might deteriorate or when they might be at risk of an adverse event. And the technology really just did not fit into the physician's workflow, and it wasn't something they could, they're so busy. They don't want to add any extra clicks. It doesn't really fit into their day-to-day processes, so it wasn't getting used, and it ends up being, not only is it a tool that could have helped patient outcomes, and it, really didn't do that. It's a big investment, and provider margins right now are really thin. So, they were able to say, we don't do AI pilots anymore without getting our end users involved up front. We make sure that our clinicians approve these products, and if they don't, we figure out a way for it to make it easy for them to fit into their workflow, and now that's a process that we use whenever we adopt a new tool. So that's, from a failure, you have a process improvement.
Yeah, and I think also the sort of like clarity around the quote unquote failure actually also provides clarity around what will work and helps you now start to seek out ideas and companies that are starting to, for example, get deep around workflows and finding solutions that fit into workflows. Which now kind of takes me to the topic of getting deep in content. And, Jessica, you're sort of attached to an organization like HIMSS, and one of the things that strikes me is that, it gives you the ability to survey across the landscape of many, many different capabilities that are coming in front of HIMSS each year. And talk to us a little bit about how understanding, generally what's going on across the landscape matters, but also how, what you do to get deep in understanding the different tools and technologies that are being developed.
Yeah, I think that I'm kind of in this very special position with HIMSS because HIMSS is an awesome company that does a ton of different things across healthcare, and we have all of these people that are just, really going after health equity and improving digital innovation, improving access to digital innovation for patients, but they also look at their editorial journals and say, you're an editorial publication. They don't dictate what we cover. And they don't even try to. They don't even say, well, you have to do this, you have to do that. But anytime we need something, we say, okay, like healthcare IT news, healthcare finance news, or MobiHealth News, we can go to HIMSS and say, okay, you guys know all of this stuff, and we want to find out information, so we're going to use you. And it's just amazing that we're able to do that with them. So as far as that goes, I do have that very special ability to access HIMSS. Vast array of knowledge. I personally must, for my own integrity, do my own research also. And so when I dive deep into something, I used to be a paralegal before I was a reporter, so I know how to dive deep into things. I know how to get into the nitty-gritty and find out all of these little nuances of something. So when you get these pitches that you guys are talking about and that we get that are just flowery, like we're the best ones and the first ones to do this, and they're like, you're not the first ones to do that. Like, it's very, very rare that a company is the first one to do anything, especially if they got 510K clearance. Like, they're not the first ones to do it. It's like you just right off the bat, you get this pitch and you're like, oh, yeah, it's just be better, But just doing your research. That's what really, I just dive deep into it and just find out all the little bits of information through like the investors that back the company, academics who have, piloted the technology, healthcare systems that have piloted the technology and maybe even invested in it themselves. So just really, really getting into the nitty-gritty of it, I think is super valuable for any journalist.
So it's interesting, as a person who sort of sees myself somewhat of a healthcare innovator myself, I read your publications, I keep like my finger on the pulse of what else is going on. I go to the trade events to keep an eye across what's going on. But recognizing what I'm seeing in what you're writing comes with you getting deep in the content, asking hard questions with that bit of skepticism. I think it's really important for us to see where you're coming from in how you produce the content in the news, and so I find that to be a really just important thing for me to keep in my mind. So I wanted to sort of think about companies. Innovative companies often are short on resources, right? So they're often trying to do more with less. And what have you observed, and Katie, I'll start with you, and then Emma, about what actually works when resources are limited, and how can companies navigate that and still tell a strong and compelling story?
Are you talking about like organizations that would be adopting tools, or like the developers, or both?
Well, actually, both. That itself is an important question. I was really thinking about the developers themselves, who may not have a big, huge comms organization, but want to make sure that when they are communicating their narrative, they're doing so in an appropriate and compelling way. But I also think that organizations who are adopting new technologies also are stretched for resources and need to look to your news to figure out now what information to take up.
Yeah, I think so at MedCity, we have a big, our readership is a lot of investors, and I do a lot of interviewing of, VCs who operate strictly in the digital health world. And I think I honestly do a lot of calls just picking their brain, not even really looking for a story, because of how fast this is moving. And I can see like the investors who were physicians who were clinicians of any sort, really do have a unique perspective. And I find them to be, have their foot in both worlds, and they can kind of help a lot of these companies either figure out how to deliver what they're promising to their customer effectively, or, if they want to help providers, payers, organizations buying these tools, they can really I think that's the best class of people to lean on to figure out, what could actually help you versus what is another flowery press release.
Yeah, and it's interesting that kind of like building rapport, having the conversation. It's not the press release right now, but actually one of the things that a resource-strapped organization can do is remember that the conversations and continuing those conversations across time matter. Emma, what do you see?
Yeah, I mean, just talking about that, I know that every resource-strapped organization founder has at least one cell phone in their pocket, if not two or more cell phones. And I think just being reachable doesn't cost any money that I know of. And so I think that's one thing that like healthcare companies or lawyers or whoever in the space don't think about very much in terms of like our relationship with the media is like you have to be available to us kind of when we need to get a story done, which can be, like, hey, I have 30 minutes to turn something around. Like, can you talk on the phone really quick? And like, if you can't, like, that's okay. But like, if you always can't, then like, we're not going to be able to rely on you as a source, And so I think being honest with the media, being willing to stay in touch with reporters that you trust are all ways that you can, over time, tell the story of your company, but also your experience in healthcare. I mean, we know we're not really going to get any interesting news out if we're just getting the news from the companies themselves and their press, the narrative that they're wanting to drive. And so I think being willing to kind of open yourself to having a relationship with a reporter is a good way to be able to tell your story and also to be able to kind of get out the truths about healthcare and not just like dirty secrets on other companies or something, but just, what's your experience of how X, Y, and Z actually works in healthcare, how reimbursement actually works kind of thing. And so I think you can do all of that without needing like a huge PR team kind of thing.
I'm going to come back to you, Jessica, with a similar question, but let me double click on something, Emma. Really to sort of, again, get underneath the hood so the audience can sort of build some additional empathy for what it looks like to be in the journalist's seat. You've described two different time horizons. One is when you've got 30 minutes to get the article out, and then the other is when you're sort of building a story across time. Can you describe a little bit about what those different types of time horizons look like so people can understand?
Yeah, it really depends on what the news is and what the story is. I like using the example of like when the physician fee schedule comes out for my friends in the room that track that. It's like, it drops at 4:15 on hopefully not a Friday night, but sometimes on a Friday night, the journalists want to get that story out like maybe within an hour, within 2 hours, depending on, and so we kind of have like what we call like, quick turnaround stories where like if something like a massive rule like the PFS is dropped, we want to get like those top numbers. How much are they slashing reimbursement? 2.5%, whatever it is. We want to get those kind of quick numbers out so the industry knows what's happening if they haven't had a chance to go click on the fee schedule yet. And then there's other stories where, and that's true for also other company news, company, a big merger or a big deal, like the same holds true. And so those can be situations where we need to get someone on the phone, like, can you talk to me in 15 minutes kind of thing, to get a quick take on what the PFS is looking like, for example. There's other stories where we can take days or sometimes, if we're lucky, weeks to report something out. That's something where obviously we have a longer time horizon, but we're looking to go much deeper into the topic and provide some, insights onto whatever the article is going to be about. And so we can have the luxury of scheduling a couple days out with a source. But yeah, those are kind of some instances where we need, quick feedback, or we can take time to do a call.
Awesome. Jessica, over to you. Let's go back to this conversation around, what companies who are trying to do more with less can do, and how they can build relationships with the media, and get kind of your point of view on that. And it also might be actually the adopters of technology, since Katie, you brought that topic up. And again, a little bit of a under the hood view of what this looks like from your side.
Well, I agree with Emma. I think that being available is always a plus. I don't I don't like it when a founder or a company or a PR person or anybody sends me an original quote that's written by AI. I can tell. People can tell, people. You can tell when something is written by AI. Don't do that. It's very embarrassing for you. And so I don't want to include that stuff. So that's under the hood. Don't do that. And then I would say that with little resource, see, I understand this idea of like, we have to have a lot of clinical backing behind your product. We need to be able to see that your product actually works, right? I also understand how incredibly expensive it is to do any type of medical research in America. It's incredibly expensive to do that, right? And so I don't ever personally, I don't cover studies that are done by companies. I know that companies need to have studies done. I want to see those studies and what the results of those studies are, but I never cover the studies directly because it could be seen as like a little bit biased. So I think that with less resources, you can still make a hell of an impact. And we're in this kind of world right now where you have all of the ability in the world to get the word out about your company, and the market's completely oversaturated for that reason. So it's like, you can use, social media and everything else that's out there to get the word out, but at the same time, that's what everybody else is doing too. So using your sources wisely as far as going to events, go to events and meet different people and talk about your story and talk to them directly about it. I mean, I think a lot of people have very interesting stories, and for the most part, people that are getting into healthcare, it's because they actually want to help people, So using your resources wisely, but at the same time, understanding, the limitations that media actually has.
Go to events, build relationships, have a story that's credible with outcomes. Katie, over to you. I'd love your thoughts on this, and also, many of us are nervous in talking to the media. Like, how should we think about building relationships and having conversations and feel less nervous?
I also wanted to chime in on some of the comments I heard my colleagues here say, because I realized I definitely misunderstood the question the first time. But I want to point out that, if you are a resource-strapped startup, like, kind of know who you're pitching to, because I never write a story within 1 to 2 hours. Like, MedCity is a small reporting team. We have way too many competitors. We're not writing those stories. We're writing analysis of news days later. So we're not the only publication like that. So, if you have a funding round or a new product launch that I couldn't get to, reach out to me about some of the news that happened in the last couple weeks and your take on it. If you have an interesting piece of commentary, that is much more interesting to me than, a $12 million funding round, which I know it sounds annoying to like turn my nose up at $12 million. But when you get so many pitches in the hundreds of millions of dollars, you have to make those choices. So I would say to be flexible and be open and be creative with how you can position your leaders' thought leadership into what's going on in the current healthcare story. And also, if you're interested in getting publicity, that can work out for you. If your CEO says something really interesting about the new Medicare physician fee schedule, and I write a longer story analyzing that, there's going to be a couple sentences like explaining what your company does and who this guy is. So, it can be mutually beneficial. I can get some interesting commentary, more nuanced commentary on an issue, and you can get, some free publicity for your company. So I would say don't be I get over like 200 emails a day. Like I will probably ignore you a lot, but that doesn't mean I don't want to talk to you. Like, keep trying.
Yeah.
Any additional insights?
Yeah, I think on that point, I wrote down, like, as I was preparing for this panel, I think a lot of times good reporting and even good, like, relationship building with media is, like, knowing that you're probably going to be ignored and turned down several times. Again, that's not because we don't think you're interesting or have anything interesting to say. It's that, again, like, we get so many pitches a day. I mean, you see the general news cycle, especially here in DC, it's 24/7 all the time. I think part of building like trust and accountability with readers is that we're only picking the most important things every week to write about. And that means that at some point, like, your news is probably going to get turned down. And like, that's okay. Like, you'll have another opportunity, a month or two later. But I think not getting discouraged by like not getting included in something, or even if we do a full-on interview with you on something and then like your quote's not included, like, again, it's not that you didn't have anything interesting to say. There's like so many limitations we're dealing with and pressures, and that I think it's more of a service to the reader if we're not writing about every $12 million funding round, when companies are out there raising hundreds of millions. Trust me, you do not want to read all those stories about the $12 million funding rounds. Like, there's way too many of them.
And Jessica.
Yeah, I just want to add one thing too. What's really interesting to me is that a lot of companies that are out there, they put out these articles or these pitches, right? They send all these emails to us, and I do, like I said, I look at every one of them, and I don't obviously cover every one of them, but I'll remember if I see an email from a company a couple weeks ago and they're making news that I would cover. Like, oh yeah, they sent me this other one, and so I could reference it like in the larger trends section for MobiHealthNews, or so it's not ever, it's not a moot point to send it. I think that it's beneficial.
That is awesome. Okay, so now you've built your relationships. You understand a little bit about underneath the hood. Let's have some fun in our last 7 minutes. All right, so Emma, we're going to start with you. We're going to come this way, and then the last question, we're going to start with you, Jessica, and we're going to go that way. So Emma, what do you think will be the dominant headlines about digital health and AI 2 years from now? Ooh, what's at the top?
2 years. I mean, that's an interesting question. I have a lot of thoughts about like the next 5 years maybe, and so I'll try to do both. I think 2 years, there's probably gonna be a lot of Medicaid stuff, like, not to be the boring like policy person in the room, but like if the Medicaid cuts go into effect, that's probably gonna be in the headlines in 2027, and how like digital health and AI is or isn't helping in those cases. We've already seen this kind of like new little market kind of crop up of like AI to help you apply to the Rural Health Transformation Fund, or AI to help, preserve people's access to Medicaid / kick people off of Medicaid when they're not eligible anymore. So I think within 2 years, probably a lot of Medicaid news, and then also AI scribe companies consolidating / getting bought out by people. I think we've already seen like a race to the bottom in that. There's free scribe now, obviously. So I think definitely not all those companies are going to survive. So.
Ooh, okay. Katie, over to you.
Maybe like no human in the loop for some of these AI tools, which I know is controversial. Human in the loop has been kind of the #1 phrase used in discussions about AI safety and responsibility, but we're also seeing all this hype around agentic AI and AI agents. And as I understand it, like, true agentic AI is completely automated with no human in the loop. So a lot of these tools we're seeing, that's not safe for clinical use right now, and that's not anything I've really seen at a health system. But I'm seeing more and more leaders, some of them at health systems, saying the workforce crisis is so bad. If we actually want to alleviate burden in a real measurable way, some of these tasks are going to have to get fully automated, no human in the loop. That's an uncomfortable conversation. We don't know all the answers of if something goes wrong, where's the liability, what will that look like? But unless the workforce crisis gets better, I think that could happen in the next few years.
That one's going to be interesting. Jessica.
Can I say what I want to happen?
Sure.
Okay, so I think that in the next 2 years, well, in the last 2 years, Google, Apple, all these giant tech companies have come out with these wearables that are doing pretty amazing things, right? Apple just announced their new Apple Watch that has a hypertension notification feature that it can actually determine if you might have high blood pressure, right? And I think that over the next 2 years, what I'm hoping to happen is that these large tech companies work with our federal regulators and are able to determine exactly how these digital health products are going to be regulated. Because you have companies like Whoop, who's going through this whole FDA problem right now, right? And then there's Apple, who kind of took that technology and was like, we got FDA clearance for it, so well, So it's like, I'm hoping that as technology progresses, because it is progressing faster than regulators are able to keep up with, that they can actually come together and decide what the best course forward is to make sure that these AI products and that these different variable technologies are not doing more harm than they are good. That's
Love
what I'm
this.
hopeful.
Oh, yes. So stay on the hot seat because we're coming back to you. What role do you see trade media playing in shaping whether the field achieves its potential by 2030?
I think it goes back to research, making sure that what we're reporting on is accurate, that it is not hyping companies at all, that it's telling both sides of the story, and that's pretty much what I'm going to say.
The details. Katie, over to you.
This is kind of similar, but I would say, reporting on ROI and making that a strong focus. At the beginning of this year, our editor-in-chief told the reporters at MedCity to really try to dig into ROI in our respective beats. So for me, providers, what are the tools that providers are seeing measurable value from, where you can point to whether it's a dollar figure or provider retention, but a return on your investment. And it's been pretty difficult to pick out those stories with it. It's easy to find health systems that will talk about a successful deployment, but it's harder to find health systems that have the numbers to back it up. So we're not going to back down from our focus on that. Hopefully it gets easier, but I think that's really important if our role is to help separate the noise from the hype, help prevent the next Theranos.
Well, that's really important because health outcomes is a critical DIME 2030 goal. Over to you, Emma.
Yeah, I mean, I think similar to being willing to admit failures is like allowing reporters to actually see under the hood of I remember this panel I was at a couple months ago. It was like health system executives describing how they changed their organizational structures to accommodate telehealth programs post-pandemic, whereas telehealth used to be in a separate weird wing of the organizational structure, how they kind of centralized it more. Okay, that's an example, and I wrote a story about that because I thought it was elucidating for the industry to know how is the organizational management of something like that changing. I think if the media has a role to play in helping healthcare actually move forward, we have to be able to tell those stories of failures or of big shifts organizations have gone through, so there can actually be learnings, I think.
And uncovering understanding. Yeah, it's really important. So with that, thank you to our incredible panel, Jessica, Katie, and Emma.